What if the very products you trust could betray you? What if a household name, synonymous with safety and care, could be linked to suffering, injury, and legal battles? In the vast world of pharmaceuticals and consumer goods, few names evoke as much trust as Johnson & Johnson. However, beneath the shiny veneer lies a harrowing truth that many would rather ignore. Over 40,000 patients have taken legal action against this corporate giant, alleging harm caused by its products. Today, we will delve deep into the shadows of this iconic brand, exposing the dark side that has left thousands of individuals fighting for justice. Why did these patients sue? What are the implications of their claims? And how did Johnson & Johnson respond to this unprecedented backlash? Founded in 1886 in New Brunswick, New Jersey, Johnson & Johnson began its journey as a pioneer in the medical industry, introducing groundbreaking products like sterile surgical dressings, antiseptics, and baby powder. The company's innovative approach to healthcare quickly established it as a trusted name, garnering respect and admiration from both healthcare professionals and consumers. With a mission centered around enhancing the well-being of people, Johnson & Johnson expanded its product lines to include consumer health products, medical devices, and pharmaceuticals. Its slogan, "The Family Company," resonated deeply with consumers, promoting a sense of safety and reliability. But as the company grew, so did the complexities and risks associated with its products. From its humble beginnings to becoming a multi-billion-dollar empire, the ascent of Johnson & Johnson was marked by innovation, growth, and an unwavering commitment to health. However, with great power comes great responsibility. As their product lines expanded, so did the potential for controversy, negligence, and harm. The very products that brought them fame would also lead to their downfall. In the late 2010s, troubling reports began to emerge, linking Johnson & Johnson's talcum powder products to serious health issues, particularly ovarian cancer. The lawsuits claimed that their talc products contained asbestos, a known carcinogen, leading to a dramatic rise in cancer diagnoses among users. Patients, now plaintiffs, recounted their devastating experiences with life-altering health implications. Many had been loyal consumers of Johnson & Johnson's products for years, using baby powder and other talc-based items without a second thought. They felt betrayed, believing they were using safe products designed for everyday use. However, the allegations did not stop there. As more victims stepped forward, the scope of the claims expanded, revealing a disturbing pattern of negligence and a lack of transparency. Women diagnosed with ovarian cancer shared their emotional journeys, illustrating the impact of their illness on their lives and families. One such individual, known as Deborah, used Johnson & Johnson baby powder for decades before receiving her devastating diagnosis. Her story resonated with many, as she detailed her struggles, treatments, and the relentless pursuit of justice against a company she had once trusted. Such personal narratives humanized the statistics, bringing a face to the often abstract concept of corporate negligence. As the lawsuits piled up, Johnson & Johnson faced an unprecedented legal challenge. Thousands of individuals united, each with their own harrowing stories of pain and suffering. The courtroom battles became a battleground not just for compensation, but for accountability and justice. The initial trials yielded significant verdicts in favor of the plaintiffs, with juries awarding millions in damages. One of the landmark cases in 2018 saw a Missouri jury award $4.69 billion to 22 women who claimed their ovarian cancer was caused by the company's talc products. These verdicts sent shockwaves through the company and the industry, raising questions about the safety of widely used consumer products. With each trial, the narrative grew more complex. Evidence emerged, painting a grim picture of corporate practices that prioritized profit over consumer safety. Documents revealed internal communications discussing the potential health risks associated with talc, raising serious ethical questions. Johnson & Johnson's response was adamant. They maintained the safety of their products, claiming the lawsuits were unfounded and that the company would continue to fight against what they termed baseless claims. The implications for patients were staggering. Many faced not only financial burdens, but also emotional and physical tolls. Lives were shattered as the reality of their diagnoses set in. Those affected shared their experiences with debilitating pain, extensive medical bills, and the anguish of uncertainty regarding their futures. The psychological impact of a cancer diagnosis is profound, often leading to anxiety, depression, and a sense of isolation. Patients faced not just the physical battle against cancer, but the emotional struggle of grappling with the potential link between their illness and products they had trusted for years. Their experiences highlighted the broader implications of corporate negligence on individual lives and families. Support groups formed, creating a community of survivors and advocates. Together, they sought to raise awareness about the potential dangers of seemingly benign products. Their fight became a movement, highlighting the importance of consumer rights and corporate accountability. This community of survivors became vocal advocates, urging others to be vigilant about the products they used and to hold corporations accountable for their actions. As public scrutiny intensified, Johnson & Johnson faced mounting pressure to address the concerns raised by patients and the media. The question loomed large: what is corporate responsibility? In an era of heightened awareness about consumer safety, companies are held to a higher standard. Johnson & Johnson's attempts at damage control included public statements, recalls, and even a restructuring of product lines. However, critics argued that these actions were merely reactive rather than proactive. Was the company genuinely committed to consumer safety, or were they merely trying to save face in the wake of mounting lawsuits? In an effort to regain public trust, Johnson & Johnson launched campaigns promoting transparency and safety. They emphasized their commitment to rigorous testing and compliance with regulatory standards. Yet, the challenge remained monumental as they navigated the treacherous waters of public perception while managing the fallout from ongoing litigation. The perception of a trusted family brand was now under scrutiny, with consumers questioning their loyalty and the safety of products they once held. Dear media coverage played a pivotal role in shaping public perception. Investigative reports unveiled the unsettling truths behind Johnson & Johnson's practices. Documentaries, news articles, and social media campaigns brought the stories of affected individuals into the spotlight, galvanizing public outrage. With each new piece of information, the narrative evolved, turning private pain into a public outcry. Activists and advocates rallied, demanding justice and accountability from a company that had once epitomized trust. The stories shared by patients transformed the conversation around corporate accountability, prompting discussions about the ethics of consumer products and the responsibility of corporations to prioritize safety over profit. The media's relentless coverage kept the issue alive in public consciousness, raising awareness about the potential dangers of talcum powder and similar products. As more individuals came forward with their stories, the call for reform in the pharmaceutical and consumer goods industries became louder. Faced with mounting pressure, Johnson & Johnson implemented strategies to mitigate the damage. Their legal teams worked tirelessly to combat the flood of lawsuits, filing appeals and seeking dismissals. Public relations campaigns aimed to reassure consumers of product safety while addressing the controversies head-on. However, the company's narrative struggled to resonate with a public already skeptical of corporate motives. Consumers began to question the integrity of a brand that had for years marketed itself as a trusted partner in health. The road to redemption was fraught with challenges as critics continued to scrutinize their actions. Moreover, Johnson & Johnson faced backlash from regulatory agencies and advocacy groups that demanded stricter oversight of consumer products. Calls for reform echoed throughout the industry, urging for better safety standards and transparency in product labeling. The company found itself at the center of a broader movement advocating for corporate accountability and consumer rights. As Johnson & Johnson navigates the turbulent waters of public perception, the future remains uncertain. The company has expressed its commitment to addressing the concerns raised by patients and the public. However, rebuilding trust will take time and transparency. In response to the lawsuits and allegations, Johnson & Johnson has pledged to invest in research and development to ensure product safety and efficacy. They have initiated reforms aimed at improving internal practices and enhancing consumer education about product safety. Yet, the question remains, can they regain the trust they once enjoyed? The path forward requires a deep commitment to accountability and consumer safety. Johnson & Johnson must not only respond to the current crisis, but also actively engage with the communities affected by their products. What if the products you rely on are not what they seem? The story of Johnson & Johnson and the 40,000 patients who sought justice serves as a stark reminder of the potential dangers lurking behind familiar labels. In a world where trust is paramount, accountability must be unwavering. The ongoing saga of Johnson & Johnson is not merely a tale of lawsuits and corporate struggles. It is a reflection of society's commitment to holding powerful entities accountable. As consumers, we hold the power to demand better practices, advocate for our rights, and ensure that our voices are heard. The journey for justice may be long, but it is one worth pursuing, for the future of consumer safety hangs in the balance.